As an overarching picture of what a challenge is, I think that I think federalism is a problem. It has been for a long time, and it continues to be so. And the Senate bill, which was the basis for the law, places a lot of authorities in the states. And in addition to the insurance regulation kinds of things, the establishment of exchanges, which are the marketplaces in which people can buy insurance that when they're not getting it through their employer, those are state-based entities. Enrolling people in Medicaid and in new plans. A lot of that's going to happen at the state level. And we will be implementing this law, we are implementing this law in an environment in which there remains a lot of hostility in a lot of places to making it work. So you really don't love having somebody who doesn't want the law responsible for putting it into effect. What that says to me about a focus of our efforts in every aspect of the law, of the implementation, is that we ought to be advocates of a very strong national push, as well as fallback arrangements, which the law allows, to make sure that we can count on, at the national level, a mechanism that will work, whether it's a high-risk pool or an exchange or an enrollment mechanism, that we have those mechanisms, and states can do it. If states have something better that works, that's fine. But I think that this is a challenge, because I do not think that that's exactly the way implementation is proceeding. But I think that with respect to achieving every aspect of reform, that's what it's going to take to make it most effective.
And Judy's pointing to a really interesting paradox, which is when you looked at the votes in the Senate for opposition to the bill, there tended the positive votes, and I've not counted this up, but I'm quite sure this is true, came disproportionately from senators who represent states that have a lower rate of uninsured, partly because those are progressive states that have bigger Medicare programs and the rest. A lot of the opposition comes in states with very high levels of uninsured. It oughtn't to be that way, but that's the way it is. And that will create problems down the line in terms of implementation, although I do think that there has to be enough political intelligence to make the point that if people are fighting this, they are actually fighting extending insurance coverage to an awful lot of people in their own states.
Well, which comes back to
and there's a racial and a class dimension to this, obviously.
Right, but what it comes back to is it's incumbent on us to make the case all the time.
Right.
If you recall, some of the issues in Massachusetts, although when we lost the election, that the argument made that they had health insurance, why should they be helping everybody else? And with due respect to the New Yorkers in the room, I have who are largely progressive. You hear that sometimes from New Yorkers. So it is a challenge to. The hardest this is going back a bit, but to my way of thinking, the hardest piece of achieving health reform is getting the money for the subsidies, and we didn't get enough money for the subsidies. And so that the benefits are not sufficiently generous and the subsidies aren't strong enough, and the problems of affordability remain. And the way the law is written, the costs keep going up and the value of the subsidies don't. And so the challenge to keep the resources in the game is really critical.
And it's a substantial political challenge, too.
Absolutely.
Right?
Well, because you will probably need some tax money. And as I see Jim Talon here, who was in the State Assembly, it's really popular to campaign on the need for tax increases.
Very popular.
But somebody's got to say it. It's easier for columnists to say it.
And the splits in the progressive community, that although we did hang together, the splits in the progressive community or among supporters of the bill were about the money.
Right.
About how we were going to pay for this bill, and that didn't get resolved until the very end, and will, I think, continue to be a challenge.
There's an enormous irony here, as you point out. I mean, a state like Texas, where I think the Medicaid program goes to 25% of the poverty level, is going to get huge, huge benefit. I mean, what people don't realize, it's something like, if you take the subsidy money and the Medicaid money, 97% of this is paid for at the federal level, 2 or 3% at the state level. It's extraordinary. But why are those states like that? I mean, it's tremendous racism in the states. We don't provide things to people because they're undeserving. And even though there's going to be, states like that where a quarter of the people are uninsured still are going to have enormous benefits, there's a resistance. Now there's all this federal money, but they still have to run the program. And, as you all said, they're going to run the program with people who want it to fail. Haley Barbour is running for president against health care, doesn't want to show that they can do it right in Mississippi, and on and on.
And the resistance is so ideological. I think you're right, that it kind of defies logic.